fries. That's
All right, you guys, so this leg here, the reason why, we only have one of these.
Burger down at
These little buggers are really
Oh,
expensive.
do they?
It's good. It's a good place. Try it.
That's a good
This one's
idea.
probably, I'm guessing, now probably close to $3,000.
This one?
Those are like $8.
Pocket
All right,
change for
so
you, Kevin.
this leg here, this is what I like to call the sexy leg.
Yeah.
So I remember, yeah, I know, I just called it that. So this model is the only one that shows all 4 hip flexors. Right, so look at your bone, or your muscle spelling list, and you're gonna see that I've categorized everything according to the group, right? You'll see that also on your muscle handout that shows all the origin and insertion and all that stuff. Right, so this one is the only one that shows all 4 of them.
We're doing the hip.
Okay, so we're doing the hip flexors first. Right, so when you look at this anteriorly, this is what you're going to be seeing on this side, and that's what I have up there. And you'll notice that up there, there's a muscle that originates up on your lumbar vertebrae. So that's this one right here. Okay, that muscle is called the psoas major. It starts, the letter it starts with is a P. Okay, so you can think of it as psoas. So it's the psoas major. That is your most powerful hip flexor, in addition to the rectus femoris, which is also a quadriceps muscle. Right? Those two together are the ones that allow you to do this movement. Okay? You do hip flexion. So they're very strong, powerful muscles. So when individuals are doing full sit-ups, right? Jesse, you were in the Marines. Who else was in the Marines in here? Army. Anyone else? Just you? Oh, only one. Okay. They had to do the sit-ups test, didn't they? Yeah. So that was really effective and efficient because you do that in battle all the time. So, can you imagine? Excuse me, Mr. Taliban, I'm just going to do my sit-ups real quick, showing you how strong an endurance I have. Okay? So, this hip flexor and the rectus femoris, those are the 2 muscles that help you the most in doing the full sit-up, right? Or when I see people at the gym, they'll be laying on a decline bench with a little medicine ball and they're throwing it at each other.
There you go.
Okay, I'm working my abs. Well, of course you are. Your abs are trying to keep your spine stable so that you don't herniate a disc because this is pulling on it so hard. Right? So the amount of force and torque that it puts on your discs anteriorly on the vertebrae is, well, it's been measured. It's anywhere from 3,000 to 10,000 newtons depending on how much force you're implementing.
Wow.
So, and that is a lot of force. I can't remember how much 1 newton equals in terms of pounds, but it's a lot. Right, so you can really injure yourself, okay, if you do repeated types of movements like that, right? Most people don't need to be doing that stuff. If you're an athlete, that's different, right? But if you're Joe, I'm gonna go work out, I would not recommend that movement for you. Yeah.
Which one is the rectus femoris?
The rectus femoris is this one,
Okay.
right here, right in the front of the
Kind of
leg.
in the middle there.
Okay,
Which one?
and then this is the
This one?
psoas major up here, right?
Well, this, like if this had the upper hip, it'd be
Yeah.
one.
Okay, so this is your psoas major. Then right next to the psoas major is a muscle that originates on the iliac fossa. This is called the iliacus,
Which one is
right
it?
here. Okay, it's just on the surface right there of the ilium, so there it is right there. Okay, that's the iliacus. So the iliacus and the psoas major. Those are the 2 that originate up here at the top.
The psoas major, right?
Major,
Next
yep,
next to your lumbar there.
right here. Okay, so these 2 are the ones that you can see really well on this leg. You don't see them on the other leg that you guys have there on your table. All right, so if I ask you any of those 2, it's going to be on this leg. Okay, so make sure today you take a picture of this one so that you have that. Okay, all the rest of them are on all the leg models.
No, which one is the rectus?
Yeah.
Is the psoas connected to all of the lumbar?
But this is quad,
Yes.
quadricep.
Okay, so it's
The middle quad, like the,
The middle
not
one,
all.
yeah. See where that thing's sticking out?
Yeah, yeah.
Just lateral.
It comes from 5 down to 2, but not 1. Or, sorry, not 5. It goes 5 to 2. Yeah. All right. No, 4 to 2. Sorry. It's not on 5. So there's your iliacus there. Okay. Then the other hip flexor, like I said, is the rectus femoris. So that's going to be anterior here. I don't have it on this picture, but it's an anterior portion of your leg. So the top of your leg on your thigh. Okay. This is the rectus femoris. Right? If you can't see, you guys, you can come up closer. I don't mind if you do that. All right, then the other one that you're going to have is this muscle that's more medial. It originates up here on the superior iliac spine, comes down crosses the knee joint and inserts medially on the tibia. This thing is called the sartorius. So this is the muscle that lets you do this motion, when you cross your leg. Okay, so when you do this, right, that's called the sartorius. So those are your 4 hip flexors on the ilium. Okay, so this is your sartorius.
Cool.
All right, this one also helps you a little bit with leg flexion, but we'll talk about that later. All right, so there's your hip flexors. And what I like to do after I do this is I like to move medially, so we're gonna move to the inside of the leg, so this is the medial, right? And that's what you're seeing up here. On this one, we're gonna do some running around to make sure you guys can see that. All right, you guys back to the leg. Okay. All right, so the first one that you're gonna see up here is called the pectineus. On your legs medially, okay, right up here at the very top, these are called your adductors, this whole group of muscles. Adduction is their job. They do this. They bring your leg back together from an abducted position. When you cross your legs over, those are your adductors. Okay, that's their job. So the first one you're going to learn is called the pectineus. It's the smallest one. And on your models, it's a little teeny tiny piece that is right next to a blue vein that happens to be the femoral vein, which is right here. All right? So it's just a little corner. So I'm going to show you where the pectineus is. All right? Next to the pectineus, and you go 2 muscles at a time so you guys can see these, is this big one that's called the adductor longus. Okay, adductor brevis, you can't even see on your leg model, so I don't even have that one listed.
Which one?
Adductor brevis,
Oh, okay.
right? And I have it in your sheets, but you don't have to learn that one. So, pectineus and adductor longus, I'm going to show you where that is.
Mangus and all that stuff.
Yeah, the gray one, the one that.
The Bra-
stuff is gray.
Varus or whatever. Brevis.
Oh, Brevis is okay.
Yeah. This piece here,
Mexico won yesterday, 2-1. And Portugal winning 2-1 right now.
right? But I want you guys to understand. So that's. Alright, so, your leg, here's your pectineus, the first muscle.
Where's your pectineus at?
I got a new phone. Look.
Cool.
Look at my cute little case. It's not cute. I'm a girl. It's just little birds.
This piece here, this is where you
It's cute.
Those are 14th tomorrow.
Ah, yeah.
All right, Spain plays Ireland.
Bank, bank.
Mexico, United States, 8:15. That's in August, right?
I'm hungry.
Wonder where they're playing at. I'm going to that game. Mexico, Mexico, ra, ra, ra.
Alright, Jess, sit them down.
Okay.
Alright, here's your pectineus,
Good.
here's your adductor longus.
Longest.
Longest?
Longus, like
Okay.
long.
I thought it was a
This-
mangus.
Longus. Alright, this piece right here,
Uh-huh.
this is where the iliacus and the psoas major come together.
I think it's so that's made to come together.
Adductor longus.
Yep, so this is the adductor longus.